Good evening, folks. I've got discussion for you. We're discussing research from the Center for Healthy Brain Aging. Okay. Let's see. Which found that older adults who experience a stroke for the first time undergo substantial, immediate, and accelerated long-term cognitive decline. Stroke is already a leading cause of disability and dementia worldwide, and its prevalence is expected to rise. The study, published in JAMA Network Open, aimed to clarify how stroke affects cognitive abilities over time. A stroke occurs when blood flow to part of the brain is blocked or reduced, leading to brain cell damage. Previous research from Center for Brain Health or Center for Healthy Brain Aging has shown that more than a third of stroke survivors experience significant cognitive decline, including difficulties with thinking, memory, and decision making. Often leading to vascular dementia. The study analyzed data from multiple international cohorts to track cognitive changes before and after stroke, revealing that stroke survivors experience a sharp, immediate decline in cognitive function, followed by gradual long-term deterioration. This aligns with broader findings that stroke impairment beyond the initial recovery period. The study underscores the importance of early intervention and long-term cognitive support for stroke survivors. Would you like to explore potential interventions or prevention strategies? Cognitive decline follow a stroke has significant medical, psychological, and social implications. Societal implications, especially as stroke prevalence rises with an aging population. Here are some key effects. Increased risk of dementia. Stroke-related brain damage can lead to vascular dementia, affecting memory, reasoning, and executive function. This can compound other neurodegenerative conditions like Alzheimer's disease. Reduce independence. Cognitive impairment often disrupts daily activities like managing medications, financial decisions, and even basic self-care. Many stroke survivors require caregiving support or assisted living arrangements. Psychological and emotional challenges. Struggling with cognitive decline can lead to depression and anxiety, folks. Okay. Next page. And frustration. Many stroke survivors experience emotional distress due to different difficulties with communication, memory, and problem solving. Impact on caregivers and healthcare system. The need for long-term support and rehabilitation places a burden on caregivers and healthcare instructions. Increasing demand for home health aides, person-centered planning, and self-directed Medicaid services. Many shape future caregiving models. Potential for recovery and intervention. Although stroke survivors experience immediate and gradual cognitive decline early, rehabilitation strategies include cognitive training, physical therapy, and hearing or vision interventions can mitigate some effects. Personalized care models like agency with choice. Many improve auditory and quality of life, autonomy and quality of life. Would you like to explore rehabilitation strategies or emerging treatments that support cognitive health after a stroke? Recovery by affecting a survivor's ability to relearn skills, follow rehabilitation programs, and maintain independence. Here's how. Slower rehabilitation progress. Stroke recovery often involves physical therapy, speech therapy, and cognitive exercises. Impaired memory, attention, and problem solving skills can make it challenging, folks. Make it harder for survivors to retain new information and follow instruction, showing their progress or slowing their progress. Future for survivors to retain new information and follow instructions showing their progress to related ability to self-manage health care. Many stroke survivors struggle with medication adherence, recognizing symptoms of complications, and making informed healthcare decisions. Cognitive impairment increases the risk of mistreatments, poor nutrition, and secondary strokes. Emotional and psychological strategies. Cognitive decline can lead to frustration, depression, and anxiety, making it harder for survivors to stay motivated in their recovery. Some may experience personality changes. Difficulty regulating emotions, affecting their relationships overall well-being, greater dependence on caregivers. Survivors with cognitive impairment often require long-term assistance with daily activities, increasing the burden on family members, home health aides, and healthcare systems. This highlights the need for person-centered planning and self-directed Medicaid services to support autonomy, risk of long-term dementia. Stroke survivors with cognitive decline are at higher risk of developing vascular dementia, which can further limit their ability to recover and maintain independence. Would you like to explore rehabilitation strategies or emerging treatments that could help integrate cognitive outcomes when a stroke? There are several effective rehabilitation strategies for cognitive decline, particularly after a stroke or brain injury. These approaches focus on restoring cognitive function and campaigning for the effects to improve daily life. Here are some key strategies. Cognitive rehabilitation therapy, or CRT. CRT involves structured exercises to improve memory, attention, and problem solving and executive function. It is based on neuroplasticity, meaning the brain can adapt and form new connections, folks. techniques include memory exercises, problem solving, games, and attention training. Complementary strategies. Instead of restoring lost function, these strategies can help individuals work around cognitive difficulty. Complementary strategies. Instead of restoring lost function, these strategies help individuals work around cognitive defects. Examples include using smartphones, reminder, calendars, alarms, and note-taking tools to support memory and organization. Errorless learning. The method minimizes mistakes during learning to reinforce correct responses. It is partially useful for individuals with memory impairments, ensuring that they retain accurate information. We're at 4 emotional adaptations. Modifying the environment to reduce cognitive load can help individuals function more independently. Emphasizes include simplified routines, labeled storage, and structured daily schedules. Executive function training. Exercises that target planning, organization, and decision making can improve cognitive control. Techniques include goal setting, problem solving, tasks and self-monitoring, exercises, physical and occupational therapies. Aerobic exercises and physical therapy can enhance cognitive function by improving blood flow to the brain. Occupational therapy helps individuals retain independence and daily activities. Speech and language therapy helps individuals with communication difficulties due to cognitive decline. Focuses on word retrieval, comprehension, and conversational skills. Would you like to explore specific exercises or emerging treatments for cognitive rehabilitation? There are several targeted exercises that can help improve cognitive function after a stroke or brain injury. These exercises focus on memory attention. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. Till then, Gator Wellness. Take care, folks.